Hello, everyone. This is Dr. Clark from the Center for Weight Loss Success. On this podcast of Doc Weight Loss, we're going to talk a little bit about vitamin D, an important nutrient you probably didn't know you needed. Stay tuned. We'll be right back. Welcome back, everyone. This is Dr. Clark. And again, on this podcast, we're going to talk a little bit about vitamin D. Vitamin D is a very important vitamin. It's gotten more and more coverage in the media over the past couple of years. We often think about vitamin D as being bone health. And absolutely it is, but it's also very important in a number of other things. Now, in theory, we shouldn't require to take in extra vitamin D because in theory we make it. We make it if we get out in the sun at all. And literally if you get out in the sun for 20 minutes kind of every week or so, you're 20 minutes at a time, not wearing sunscreen, in theory you should make plenty of vitamin D. But for whatever reason, as Americans, we typically don't make nearly enough vitamin D, and so we actually need to supplement this because vitamin D deficiency is what I'll call is endemic in the population, probably more epidemic in the population, that many people are vitamin D deficient. From the patient population that I see here in my office, it's probably close to 90% of the patients I see. The more someone is overweight, the more likely they are actually to be vitamin D deficient. But if you look at all comers, about half the American population is deficient in vitamin D. And just because you're maybe not deficient doesn't mean you actually have enough. As we've talked about multiple times through these podcasts, and if you've ever listened to my webinars at all, I talk about balance and what is optimal or not. And sometimes normal ranges aren't necessarily optimal ranges. And vitamin D is another one of the things. Just because you made it up to the normal range, if you're on the low end of the normal range, you are certainly not in the optimal. We really like to see this in that over 60 range, like 60 to 70 range, and normal's up to 100. I don't know that I've ever seen someone in those ranges without supplementing it. So it's endemic in the U.S., and literally about half the American population is low in vitamin D. Now, again, we often think of vitamin D as bone health, but also lots of other things are involved, because if you're insufficient in vitamin D, when I say insufficient in vitamin D, I mean anywhere less than 60. And technically, in that 30 to 60 range, it's still normal, some low half of normal. But anyway, it's less than 60. There's some significant increased risk of other problems. Significant problems are cancers. Other problems are heart problems. Other problems are increased risk or increased worsening of symptoms or problems with autoimmune diseases. So it's back up on the cancer. Basically, there's about a 5-fold increase in the risk of developing cancer in someone that has very low levels, even low normal. And that's including colon cancers, breast cancers, prostate cancers, lung, kidney. So a number of very common malignancies actually become, the risk of developing them becomes much worse when we have very low vitamin D. All right, what about heart problems? Okay, obviously heart problems are very common in the U.S. It's one of the most common reasons for someone to die. But if you've got low vitamin D levels, you've got about 2 times the chance of developing a heart attack or a stroke. And if you have low vitamin D levels, even if you don't develop heart attack or stroke, you've got about 160% increased risk of developing coronary artery disease, where you may not have actually had a true, stroke or the clotting of the blockage of the artery, either of the heart or up to the brain, but you've got it actually that it's starting to impede blood flow. So if you have much higher increased risk of coronary artery disease. So for these 2 reasons right there, incredibly important to find out, get screened for it, as well as to find than treated. Now, the other thing I mentioned was autoimmune disease. So basically, these are inflammatory things, and they're autoimmune means you are making antibodies. Your body's making antibodies to something in your body that it normally shouldn't. So rheumatoid arthritis is a classic example where your body actually makes some antibodies to the joint space in there, and it causes an inflammatory reaction, the swelling and pain we see with rheumatoid arthritis. But you can also get this with MS, muscular dystrophy. Multiple sclerosis, or even a worsening in diabetes type 1. Diabetes type 1 is where often it's an autoimmune disease where it attacks your pancreas and you don't make insulin anymore. Again, insulin is one of those hormones, you need it to survive, but you want to have as small amount as possible. But type 1 diabetics don't make any insulin. And it's often an autoimmune response, or you get inflammatory reaction to the beta islet cells in the pancreas, and they're no longer making the insulin. So you get some significant worsening of other problems when vitamin D runs low. Now, as I mentioned, we often think about it as bone health. Okay? So it ought to be treated for bone health too. Now I'm going to go into that in a little more detail though. Typically, to really develop good, healthy bones, you need about 5,000 units a day. In theory, again, if you're out in the sun, you would make this yourself. And we make it actually from the cholesterol in the body. That's where we make it from. Vitamin D actually looks very much like a hormone, even though it's a vitamin. Okay? But it really helps, again, with this bone metabolism. Right? You want to have nice, healthy bones. We often think of calcium. You got to have calcium for healthy bones. But actually, most of us actually take plenty of calcium. We just don't utilize it effectively. If you take in too much calcium, that can cause other problems. So the vitamin D is what really helps you utilize it effectively. But I do want to take that a couple steps further, because vitamin D, one, you want to make sure you have the right kind of vitamin D. The best vitamin D is vitamin D3. So if you're looking at labels out there, look for vitamin D3. And about 5,000 units a day, if you run low, is going to be the right dose. Often people come to me and say, I'm taking vitamin D, I'm taking 1,000 units a day. That's high dose. Like, well, no, it's not. That's actually a very low dose. Okay, 5,000 units a day is probably appropriate. Occasionally they'll come in, they'll tell me that, gee, my doctor's giving me 100,000 units every week or every 2 weeks or every month or whatever. But if you think about it, what you really want to get is a daily dose there. About 5,000 units a day is what you should be on. If you're starting really low and trying to bump that up, then probably about 10,000 units a day would be appropriate as well for 3 or 4 months at a time. In theory, you could overdose on vitamin D, but you'd have to take monster amounts, as well as if you get in plenty of vitamin A and vitamin K2, you can't actually get toxicity from any of those 3 vitamins because they work then in synergy. So I'm going to back up a little bit and talk about, okay, how do we get these vitamins to work in synergy? And now we're talking about true bone health, bone metabolism, because it's not just vitamin D that helps with our keeping healthy bones. You also require vitamin A and vitamin K2. Now, there are actually 3 types of vitamin K. K1 is the one we often think about if you're familiar with, you got to avoid vitamin K if you're on a blood thinner. And the vitamin K, it's in all the green vegetables and that type of thing. Well, that's not the vitamin K I'm talking about. I'm talking about vitamin K2. Vitamin K2 is menaquinone. Vitamin K1 is phyloquinone. Phylo, kind of the green vegetables there. But menaquinone actually comes from it's made along the intestinal tract from some of the bacteria that live there. But vitamin K2 helps move calcium into the proper areas. So if you think about it, you want your calcium that you take in, whether it be from food or calcium supplements, you want the calcium that you take in to get the right area. And where you want it is not just in the bone, but actually building healthy bone. You want healthy, strong bone, not to just get it kind of plastered into the bone. Calcium all by itself basically is what hardens concrete, and your bones really aren't concrete. They're living tissue there. So you don't just want a blob of this calcium in one place. You want good, healthy bone. So in order to do that, you need vitamin D, but also this vitamin K2 and vitamin A. So vitamin K2, ideally you want approximately 500 micrograms per day. The other thing that K2 does, it helps get your calcium into the bone, but it also helps get it out of the arteries. So, if we just throw calcium at you and kind of get your calcium level, kind of your bone levels way up, but calcium, if it's not told where to deposit, it can deposit in the wrong places. It potentially can deposit into soft tissue, and so some people actually make little bony fragments kind of in their soft tissue. But kind of worse than that is if you get if you get calcium deposited in your vessels. And calcium in the vessels, it really does cause hardening of the arteries, and blood flow won't go very well if you've got a really hard artery there. You want arteries nice and soft and pliable. So the K2 actually helps with the D to get the calcium in the appropriate place, so it takes it out of it, actually mobilize it out of the arteries. So it removes it from the arteries and some of the soft tissue there. That's the K2. The vitamin A we often think of as, helping with vision, specifically night vision, but it's also important in skin integrity, immune function, and yes, bone and teeth. And it's really important in bone and tooth remodeling. So you're just not throwing calcium at this, but you want to remodel it in appropriate so you have nice, healthy bone and teeth. So the three things need to work together. Vitamin A, it's about 5,000 units a day. Now most people won't get this just taking an extra vitamin or just taking their multivitamin. So what we've done, and you can find this at some health food stores, is actually put the three vitamins together: vitamin D, vitamin A, and vitamin K. We refer to it as A, D, and K. Okay? But you put the three supplements together, and we know we're getting the right synergy with it, the right amount from each of them, and we can get the right, you can get those right levels in the tissues then. All right, so if you want good, healthy bones, vitamin D is absolutely key, as well as vitamin A and vitamin K. Then, just like we've talked about multiple times, balance is key. And this is true with hormonal balance, this is true with health, this is true with exercise, it's true with really our overall life. Balance is key, especially here with vitamin D. All right, so hopefully you can go out and get vitamin D, 5,000 units, vitamin A, about 5,000 units, and then with the vitamin K2, about 500 micrograms. That combination will typically get you in the right progress of making good, healthy, strong bones. All right, if you're looking for more information, just go to our corporate website, which is cfwls.com. If you want more access to me and have questions, you can get that through Losing Weight USA. Just go to that website, losingweightusa.com. Sign up. You'll get weekly tips as well as weekly recipes and access to me on a webinar where you can ask questions. Again, thank you all for listening, and remember, it's your life. Make it a healthy one. Take care, everyone, and take your vitamin D.